good, but I lost everything in a card game, and nobody understood. So my woman packed up everything we had, lost the kids and the car and all. She didn't leave me nothing, man, not even a number that I could call. She had to roll on. She had to roll on away from me. Hey, these blues were all I gave, so I just had to let her be. I'll go to the pawn shop and hawk away my heart. I damn sure don't need it none. Man, it's been torn all apart. That ought to give me enough money to hop on a freight train. Or better yet, I'd just go rob somebody. I can live up to my name. But I gotta roll on. I gotta roll on down the line. Hey, these blues are all I got, but at least they're all mine. I gotta roll on. I gotta roll on down the line. Yeah, these blues are all I got, but at least they're all mine. Well, I rolled and I tumbled, cried the whole night.
Porter is on the line now, so Betty. behalf of the media. So we will begin shortly. Good morning, I'm Sydney Benter with Austin Public Health. We appreciate you joining us for today's news conference. Spanish interpretation is available on ATX and 3. First, we'll hear remarks from Dr. Desmar Walks, Austin Travis County Health Authority, followed by Adrian Stirrup, Interim Director, Austin Public Health. Then we'll hear from Mayor Steve Adler and Travis County Judge Andy Brown. Finally, Lauren Huffman, President and CEO of the Greater Austin Chamber of Commerce. Afterward, we'll open it up to our pool reporter who will ask questions on behalf of the media. Let's begin with Dr. Walks.
Good morning, everyone. We're here today, unfortunately, to announce that we are re-entering stage 5 of our risk-based guidelines. We haven't witnessed the behavior changes necessary to curtail the current spike, and many people are experiencing asymptomatic mild disease. But with this rapid spread of Omicron, which will continue our healthcare system, and it's impacting our community's infrastructure. Without action, our communities stand to lose more than they already have. Workforces are short-staffed, and hospitals have been stressed by staff absences and staffing shortages as a result due to Omicron. There will come a point when schools and businesses and community centers won't be able to open their doors if we don't do something. We've already seen this nationally with airlines having to cancel flights. So what does this mean for us? The places where we go for care will be short-staffed. The places where we go to eat will be short-staffed. And the places where we go to buy goods and services will be short-staffed if we don't do something. Our way of life is in danger. We know Omicron is far more transmissible than the variants that have come before it, so we must act accordingly. Our stage 5 guidance is for those who are fully vaccinated and have received their booster if they're eligible, should take part in day-to-day activities while wearing masks and taking precautions. Those who aren't fully vaccinated should be avoiding gatherings with others and travel, and choose curbside takeout and outdoor options for dining and shopping. I know everyone is tired. We are all tired, but among those of us who have not been acting as though we are in stage 5 and have been taking those measures that they would normally do in stage 1 or 2, I'm reaching out particularly and asking that you take heed to the stage 5 guidance. Our UT modeling projections show that if we do what is necessary to adhere to the stage 5 guidelines, there's hope to keep our schools, childcare centers, and businesses open. We need everyone to follow stage 5 guidelines. We can right this ship. And with that, I will turn this over to Director Stirrup.
Good morning. Thank you, Dr. Walks. At Austin Public Health, our mission can be boiled down into 3 P's: protect, promote, prevent. And right now, our primary mission is to prevent the spread of COVID-19. Every day, our staff is working in partnership with community to make sure that you have the information and resources needed to make good decisions for yourself. Right now, our community transmission rate is higher than we ever imagined it would be, 1,067. I think back to a quieter time when those numbers were in the 50 range. And so, the challenge before us is daunting, but I'm not worried because as a community, we are prepared. We know what to do. We've been here before. So right now, we need everyone to redouble their commitment to wearing masks, even if you've been vaccinated, even if you've been boosted. And if you haven't had the opportunity to do either yet, it's more important for you to mask as well. We need your help to continue to stop the spread. Masking up helps our doctors, our nurses, and all the medical personnel working tirelessly in our hospital system. They need your help. Do it for yourself, do it for others. We keep our homes healthy and our businesses open when we follow good practices. As a business, if you need information, guidance, or resources to keep your workplace healthy, please check out atxrecovers.com. We want to keep our businesses open and our economy moving. We have all of the tools available for this fight. APH continues to operate testing and vaccine clinics, and we allow walk-ups. There's no cost, there's no registration required. Several of our locations offer all 3 vaccines and boosters, as well as the pediatric vaccine. And in addition to those static locations, we will continue to have pop-up clinics in those zip codes that have yet to reach that crucial 70% target that we set long ago. Let's take advantage of the tools, resources, and knowledge available to us to protect our community. And with that, I pass it on to Mayor Adler.
We may have switched up the order there.
I beg your pardon. Yes, Judge Brown. Thank you.
I'll step in and then pass it to Mayor Adler in just a second. But thanks, Director Stirrup and Dr. Walks, for all of your hard work. Thanks for everything that you've done to help keep our community safe up till now. I'm going to ask you, our community, to help keep schools open, help keep businesses open, and help keep our workers safe. Please wear a mask, get vaccinated, and get boosted. Those 3 things are critical. Wear a mask, get vaccinated, and get boosted. Encourage your friends and family to do the same. Even if they have had COVID, they still need to do those 3 things. This will help keep kids safely in schools, keep our businesses open, and let families return home safely each night after work. None of us wanted to start 2022 with a surge in a new COVID variant, but here we are. I remain hopeful, though, and I believe in Travis County and the City of Austin and our collective power to overcome this. Yesterday, I dropped off my 1st grader, Hattie, for her first day of in-person school in 1st grade. And by the time I had picked her up from school, we were already discussing the community conditions that would lead to today's move to stage 5. That was tough news to hear. I know that my family is doing our part to protect the people that we love and our community, especially protecting our teachers, our school workers, and our healthcare providers. We wear our masks to school, at work, and in public, and we're vaccinated and boosted. And I'm asking you to do the same today. The mandates for mask wearing that we have for people in schools are still in force. Some folks were getting accustomed to not having to wear a mask, but our health experts, those here on the press conference today and those nationally, are telling us that we need to mask up again and that we need to do so to keep our schools open and keep families safe. Our health experts tell us that vaccines and boosters may not ensure that we don't get sick at all, but they will ensure that we don't end up in the hospital with severe conditions or death. And the length of COVID-19 will be reduced should you get it if you're vaccinated and boosted. Each of those things, from masking to vaccines, are going to help us keep schools open, businesses open, relieve our hospital workers, and allow each of us to get back to what matters most, our family, our friends, and the people we love. We've been here before, and Travis County and Austin stood up, and we're here again. And I believe in us, and I know we can do it again. Thank you very much, and I'll pass it on to Mayor Adler.
Judge Brown, thank you. We are truly fortunate in our region to have such a great partnership between the city and the county. So thank you, and thank you to the county staff and to our own city staff. You know, everybody all around us, I am sure you are seeing the same thing that I'm seeing. We are seeing more and more people around us getting this Omicron variant. We know that the infectivity and the number of infections has dramatically increased. It is now more important than ever for everyone to mask everywhere. It is our best chance to keep our hospitals staffed and our businesses open with healthy employees. So how many of us have had to wait in long lines at all different kinds of businesses, restaurants, retail, other service sectors because they didn't have enough staff? We're seeing that more and more. How many of us have heard the stories, read the articles about how our hospital system is understaffed and stretched thin? Healthcare employees absolutely exhausted. If we don't take action now to stop the spread, to flatten out the spike, to keep ourselves and each other healthy, then we could see an even greater impact on staffing levels in all industries, especially in our hospitals. Now, we've been here before. We know what works and we know what to do. I'm also aware that we are all tired and we want to be done with this virus. But this virus, as we all have been saying, is not done with us. So we really need each of you to be even more vigilant, to take even more vigilant action to protect our community, our workforce, and our economy. The more the number of people that get this virus, the greater the reach of the infection, the greater will be the number of hospital workers that are out sick, store clerks who are out sick, police, fire, EMS, first responders that will be out sick. The greater the chances that facilities and services and businesses are going to be impacted. We have got to slow the transmission of this virus. We need to flatten out this spike. To keep Austin open, to keep our workforce healthy and working, it's critical to mask, to get vaccinated, to get boosted. Right now, please, especially to wear masks whenever you're out in public, indoors and outdoors. Every additional layer of protection we take for ourselves goes a long way in helping our business community, our hospital system, and all of Austin. I would note parenthetically that the city provides a wealth of resources and tips for businesses to help recover and maintain a healthy environment. And to learn more, I urge everybody to go to atxrecovers.com. That's atxrecovers.com. Neighbors, we are in a new stage of this virus that presents new challenges, and it requires a little bit more diligence for just a little bit longer. And with that, I'll turn this over now to Laura Huffman. She is the President and CEO of the Austin Chamber of Commerce, such an incredibly important partner in helping to keep our city and region strong. Laura.
Thank you, Mayor, and thank you, Judge Brown. Also, just a moment of gratitude for you, Director Stirrup and Dr. Walks, and for all that you're doing for our community. Look, we've all thought it. The last 2 years have been challenging. Most of us have said it. It's also been exhausting. And one of the things I want to do is just express my appreciation to this community for being so patient and leaning into making sure that we are as healthy as possible as a community. We know that the people of Austin are hardworking and resilient. It's reflected everywhere. It's reflected in our talent pool. It's reflected in our economy and in our local businesses. So I'm confident that as we ask our community to come together for this common goal, the people of Austin are going to do what it takes. For many of our businesses, employees are considered part of a family. And customers are also. These are our favorite restaurants, our favorite places to shop. These are the places where we work. And at the Chamber, we've seen firsthand that business owners have been struggling to keep their doors open, and they want to stay open. They want to stay open for their employees, and they want to stay open to serve this community. We owe it to ourselves and to each other to keep our loved ones and our community safe. And the best way to do this, as you've heard from our public health officials, is to wear a mask, get vaccinated, and get boosted. All of us can contribute to the health of this community. We started a campaign at the beginning of COVID to be a city of us. It's a chance for us to come together as Austinites. And we really do believe that a mask on each of us will be a win for all of us. And I believe with that, we're going to open it up for questions.
Correct. We're going to go to our pool reporter, Betty Cross from CBS Austin. He's going to ask questions on behalf of news outlets. We are going to try to get to as many questions as possible before 11:30. If your questions are not answered, you, of course, may send them to apHmedia@austintexas.gov. Betty?
Good morning, everyone. I'll get right to it. The first question is from me, and it's Travis County's positivity rate now stands at 29.3%. Do you think that number accurately reflects the percentage of people testing positive since at-home test results are not included?
Good question, Betty. We know that there are many people in the community who are doing at-home tests, so that the numbers that we're seeing are an underrepresentation of what the disease burden is in our community. We estimate that there may be 3 to 4% of those in our community who are sick at this point. So to break that down for practical purposes, if you're in a group of 25 people, say, you could safely assume that there's at least one person in that group who's been affected by Omicron and is sick. And so we know that there's a lot of virus in our community and it's spreading fast.
The next question is from the Statesman. Does moving to stage 5 mean cancellations of major events or city events?
We are not planning to cancel anything at this point. We are going to be looking at the things that are going on in our community and helping to make sure that those events are being conducted in the safest and the ways that we know are going to protect our community from further spread of the disease.
Can I follow up on that? Just in the sense of Omicron is so different than Delta. And I know that like during ACL and some of the other events, it didn't spread and we didn't see really almost any impact because it really wasn't airborne. Do you feel like there's a difference now with the Omicron variant and how it should be handled?
Actually, the virus itself is spread by aerosolized particles, and this one is showing to be spread a lot more because there's more virus that's in the airway that's produced. So we were able to mitigate or stop the spread and stop the number of cases from being high by doing what we're talking about and what I just mentioned, which is putting in place mitigation strategies, having people test before they came to that event and before they come to future events, using masks, making sure that people are getting vaccinated before they gather in large groups. So those are still mitigation strategies that are effective, and those are the types of things that were employed for previous events that we've had and ongoing events. So those are the things that we will continue to do to keep our community safe.
Thank you. The next question is from KXAN. AP is reporting that in some places, 2/3 of people included in COVID-19 hospital numbers are testing positive for the virus while in the hospital for other reasons. Is that ratio accurate locally? How does that compare to previous surges?
Locally, we're seeing about 30 to 40% of those who are in hospital for other things are testing positive for COVID. And we're looking at that data to see how that's going to impact the clinical course of those individuals who were initially admitted for other reasons. So we are seeing more of that phenomenon of people who are being admitted for other reasons who are testing positive for COVID-19. And we've always counted those in our counts of hospitalized cases.
The next question is from KVUE. How many staffed ICU beds are in our area right now?
Currently on the Department of State Health Services website, we have listed 37 adult ICU beds available and 11 pediatric beds available. But let me be clear that that number is a dynamic number that changes because we have admissions and discharges throughout the day. So we keep, someone is always monitoring that and making decisions accordingly when we need to have people admitted to the hospital.
Univision asks, this week Dr. Walk stated that out of the 647 deaths that we had from COVID in 2021, 55% were Hispanics and the majority were not vaccinated. What are we going to do differently to try to educate the community into getting vaccinated?
I'll start with the answer to this question and then ask Director Stirrup to add on as well. But we've had an ongoing campaign to go into the community and educate, answer questions, and do the things that we felt would help improve the vaccination rates in our community. There's still a large group of individuals who are impacted by the misinformation campaign, but to be clear, this vaccine has been deployed to hundreds of millions of individuals safely, and this is a vaccine preventable illness. In the case of Omicron, as we've noted, there are people who are experiencing mild disease because we've allowed this virus to infect people and it's mutating. And it's important that we realize that even though we're going to possibly get a mild disease or not a lot of, we're not going to need to go to the hospital or have ICU care. But every time we let this virus infect somebody, we're giving it a chance to mutate and change its characteristics and become more dangerous. So it's important that we protect ourselves. It's important that we get vaccinated, and it's important that we mask so that we can stop the spread of this virus in our community.
Thank you, Dr. Walks. And just to add on to the point about the disparities within our Hispanic population, as we've said many times, COVID-19 has exacerbated the disparities that have existed in those communities. There's a direct correlation with some of the things we see with respect to chronic disease and illnesses. So this is not a sprint. This is a marathon. So It's continuing to do what we have done, working across the county with our partners, making sure that our vaccines are accessible in terms of geography, in terms of language, in terms of service delivery, using those good public health practices like community health workers in places and spaces where we live, work, and play, continuing to work with our school partners and businesses, and having an intentional focus on those communities and zip codes that need extra support. And the second part of that is that we will continue to hear from our community what's working, what we need to continue to do. So it is a question of not necessarily different, but more of and more intentional focus.
The next question is from KUT. Dr. Walk said this week that hospitals are seeing more people who've been admitted for a reason other than COVID who later test positive. Does this mean that fewer patients hospitalized with COVID are requiring oxygen and intensive care?
At this point, we are still looking at the data to determine whether we are seeing that to be true. We've had such a rapid rise in cases that it's too early to definitively say that that will be the case. This is a disease process that evolves over time. So as we get more data, we'll be able to definitively say that, yes, there's less need for higher levels of care.
KOOP asks, after reviewing AISD guidelines for the return to the classrooms, it appears that they are depending on individual diligence and honesty. Is this in accordance with APH Stage 5 advice?
Could you repeat that question for me, Betty?
Sure. After reviewing AISD guidelines for the return to the classroom, it appears that they're depending on individual diligence and honesty. Do you think that's in accordance with moving to your Stage 5 recommendations?
Our Stage 5 recommendations are just that, and we are relying on our community to come out and be in public wearing masks in all situations. And so that is the call to action here. We're asking our community to mask in all public situations, indoors, outdoors, travel, shopping, dining. And we're asking those who are at high risk, those who are unvaccinated, partially vaccinated, or need boosters, or those who are medically at risk to take those precautions of avoiding crowds, avoiding unessential travel, avoiding going into indoor dining areas so that they can protect themselves from getting this disease.
Betty, I'd like to jump in on that a little bit in relation to AISD. I just want to say that they've been a real leader throughout this whole effort in making sure that masks are enforced and actually worn in the public schools that they run here in Austin, as has Del Valle ISD and many others. And I've seen just today that my own experience with my daughter, who's in an AISD school, as well as Dr. Elizalde's messaging to the community, that they continue to follow APH guidelines and sometimes even do more than that. And they've been really great on requiring masking and other things.
Thank you. Community Impact now asks, as hospitalizations rise, ventilator use seems to be increasing slower than past surges. Is that a lag or an indication that the Omicron variant might cause less severe illness?
The data that's coming in from other areas is showing that those who are impacted to the point that they have severe enough disease to require hospitalization for a COVID-related illness are having as severe a disease course or a clinical course as we've seen with other variants such as Delta. But again, it's very early in our surge, and we are still collecting that data to see if indeed we will have less need for those higher level care resources.
The next question is from Fox 7. Are there recommendations for private businesses now that we've moved to stage 5? Should they scale back on capacity or make other changes that might facilitate the process?
We are asking our business community to require or recommend masking as people come into their establishments. We're asking them to have their staff mask. We're asking that when people go to the businesses that they are choosing curbside and takeout options when they can, so that we can decrease the amount of interaction in indoor spaces. And we are also asking for social distancing, so that may require some changes in capacity in our business places and spaces.
That was the end of the first question from the media. Now we're moving on to the second question. So we're back to CBS Austin. Do you think the Omicron surge is likely to ease at the end of January, considering what happened in South Africa? Or could schools reopening and maybe a lack of masking in the community impact the time frame?
The length and breadth of this surge is going to be really dependent upon how our community responds. It is important for us to mask, get vaccinated, get boosted, so that we can stop the spread and therein decrease the length of this and time that we're experiencing the surge. It'll also do what we need it to do, which is decrease the number of cases and the impact on our hospital systems, businesses, and schools. So yes, the schools reopening will have an impact, and it's important that we take those precautions that we know will work to decrease our case numbers.
The Statesman asks, how long do you expect Austin and Travis County to remain in stage 5?
I think that probably that's going to be up to the community in terms of whether people will step forward and have more people wearing masks in more places. I think it's kind of up to us at this point.
A little bit of a crystal ball question, but I know that's what a lot of people will be asking as well. So I appreciate the Statesman's question. From KXAN, what issues are hospitals facing now that they may not have in previous surges?
The Omicron surge is different in that we are seeing more staff out sick, and that's impacting our hospital systems and businesses and schools because we have staff shortages.
KVUE is asking, what do efforts look like in recruiting more staff? I think they must be talking about hospital staff. They don't say that there, but that's the only thing I can think that they're asking.
We have requested and received contract staff from the state, for which we're extremely grateful. And that's going to help to some extent, but we are having large numbers of staff who are out sick. And so that continued spread of Omicron is continuing to impact us and will continue to do so until we as a community start to increase our efforts to mask and vaccinate and get boosted.
And Univision wants to know, how much of an outbreak in schools will it take to get a recommendation from health officials to go back to virtual classes?
As a public health entity and as a health authority, we continue to be in contact with the schools, and we are in the position to help advise and to quarantine schools as needed. The decisions on virtual learning versus in-person learning are things that reside with the school's administration and the Texas Education Agency.
KOOP has an interesting question talking about antigen testing versus PCR testing. They ask, since test results are critical for making decisions, does APH recommend PCR testing over rapid antigen testing results when someone has been exposed to the virus?
We are recommending for screening purposes antigen testing early on in the course of this disease. That is a great tool to identify those who may be sick and infected with COVID-19. We also are recommending confirmatory testing for those who are symptomatic and may test negative with the antigen test early on. And for sure, if someone is symptomatic and they receive a negative antigen test, they should still self-isolate, not go out into public, not go to work, not go back to school until there's established that it is negative with the PCR test.
I'm going to follow up again, Dr. Walks. I'm so sorry. But I think there is confusion in the public about that antigen test. Is it reliable? Can they count on it early on and maybe in the later stages of their time with COVID to give them an accurate result? Do you feel like it's reliable, especially in the early and later stages of having COVID?
The antigen test is effective and an effective tool for us to diagnose COVID-19. As there is less virus available and as the disease progresses, the PCR test continues to test positive. And so we know those parameters and use that information to guide our treatment and clinical care of patients. For the general public, the antigen test is an effective tool for screening and identifying cases. And again, if there's symptoms and you have a negative antigen test, you should stay home, isolate, do not go back to work or school. And either repeat the antigen test or get a PCR test, which will definitely help to confirm whether you are negative or positive.
Thank you. I appreciate it. Community Impact now asks, are the most severe cases still concentrated among the unvaccinated and partially vaccinated?
We are seeing cases in the unvaccinated and partially vaccinated and those who are eligible for a booster. And in all of those situations, there is not the protection of the antibodies that are developed as a result of having received your vaccination. In the case of Omicron, however, we are seeing many people who are vaccinated and some who are boosted, particularly those who are have medical conditions or are of advanced age and have less immunity built up. In those instances, having breakthrough cases and having mild disease. And that is because we're dealing with a different form of this virus that is able to do that with our current vaccines. Having said that, it is important that we continue to get vaccinated to protect ourselves from getting severe disease, to protect us from having to go back into the hospital, and to protect those of us who are vulnerable to severe disease and death. So it is still important to get vaccinated. And it is still important to protect ourselves from becoming infected, because we do not want this virus to mutate and cause even more serious variants.
Fox 7 has our last question this morning. How severe is Omicron for children? What are the pediatric hospital admissions looking like?
We're seeing increases in the number of cases in our pediatric population, and it's anticipated that those numbers will continue to increase as school reopens, particularly in those who are unable to be vaccinated or have not gone to be vaccinated yet. In our hospital systems, we're seeing children admitted, and for the most part, those are children that are unvaccinated that are requiring hospital care.
That was the last question from reporters, unless I could ask a few more. I'm just kidding. Thank you all so much.
We appreciate your time, Betty, and we do thank Dr. Walks, APH Interim Director Adrian Stirrup, Judge Andy Brown, Mayor Steve Adler, Laura Huffman, President and CEO of the Greater Austin Chamber, and our pool reporter, Betty Cross from CBS Austin. We appreciate everyone joining us today. Have a good one.